I wanted to tell you about how operations actually happens on life versus the books and the courses. Of course, those are the guiding principles and pillars on which everything will rest. But in operations, it's a very, I would say, hands-on deck approach. Operations is also a lot of real-time, on-ground, practical decision making, which you will never learn in the books. And hence, the all if you for this career, I said at the start, it's a mix of strategy and execution, strategy and fieldwork. So this is a use case of your Varanasi railway hospital. One of the companies I worked with, right, was used to supply equipment to them. But here we went beyond equipments, right? At GE, we worked with the Homi Baba Cancer Center, the Tata team basically, right from sourcing where the hospital would be. I'm giving you a very, very short thing, okay? The railway did an entire analysis on where this hospital needs to be put. They had like the Central Railway, Western Railway, and they had their nodes, and they did a lot of R&D on which hospital would maximize their railway employees and the patient flow in that area. So that whole work was done in the background. That whole research work was done in the background before even finding Varanasi mein karna hai, or before even looking at where in Varanasi. So all that R&D took months, I would say, right, before we finalize the location. Then in that location planning, what kind of land is it, how far or near it is from the road and railways, how easy it is for patients to reach, how easy is it for my building material to reach, because you need to build the hospital from scratch. So all of that land planning, working with the architect, working with the land developer, or everything went into place, right? Then we have the maps, then you see the build stage, and finally the hospital is ready. So this itself tells you, it's a, if you're working with a team which making new hospital, it's so operational, I would say nightmare, but an operational challenge which you are taking on, and that you really get involved. So it's a big process to establishing a new hospital. Then after that, obviously, in the planning stage itself, you have to decide which department goes where, which equipment needs to be bought in first, because you don't want to waste a lot of management money, and others you'll be questioned on wasting budget. So which are the bare minimum equipments which can be added later on? If it's a cancer hospital, obviously require cancer equipments to be added, like the case was here, right? Then we got consultants from outside also who have done this cancer specific hospitals for consultation, for telling us what can be done better. Then setting up the OPD, IPD departments, all of the other things, hardware which goes from your reception area to patient waiting area, the IT systems, how do we manage patient records, what all providers we get into, looking at different vendors for procuring all of that, and then testing it before making it operational. So I think I came in the company in middle of this process, and I was not a part of the direct team which worked on it, but the team which worked with this became their life day in and day out. So those were operations specialists, and they were not only excellent strategists, I would say, who draw things on paper, but also iterate every month or every week initially to go back to the drawing desk, change things, look at how costs can be optimized. If some project timeline, like if you make a Gantt chart, and if the chart has exceeded 4 or 5 weeks, then we are a few lakhs down, right? So how do we save those costs back? So this is one beautiful use case. If you are getting a part to be of a project which is from scratch, start to end, please take that opportunity, irrespective of the pay, because it will give you great dividends on learning how to set up the systems in rest of your career. This is the last part. When it has been set up, equipments are all there, people are all hired, and then upskilling or training is going on how to use equipments, right? It's just that equipments will not teach you, right? You have need to teach them. So this is the training and upskilling which is going on, of how to actually use them with the training staff. This is the last mile of that project.